Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about what's biting you this spring. And our special guest is Eileen Konkuski, a communicable disease nurse in the Frederick County Health Department. Eileen, welcome and thank you for joining us.
Thank you for having me.
So what is biting people this spring?
Usually most often I get inquiries about either Lyme disease or rabies about this time of year.
Okay, so let's start with Lyme disease then. What is it?
It's a bacterial disease that is transmitted to humans from the bite of a particular type of tick. In Frederick County, it's the deer tick, and unfortunately, at its earliest growth stage, it is no more bigger than a poppy seed, so it's very difficult to detect it when it gets on the body.
Wow, so that is very small, no bigger than a poppy seed. So maybe we should talk then about why is it important to prevent exposure to ticks?
Because Lyme disease itself, if it is not diagnosed and treated, can cause severe problems later on in life, cardiac problems, neurological problems, problems with the joints. It just has a lot of bad side effects later on down the road.
So what can people do to then prevent Lyme disease, prevent exposure to ticks? What can people do?
Stay away from areas where there is tall brush or tall grass or leaf litter piles or stone walls. That's where ticks like to be, and then when you walk by, they will just get onto your clothes and go from there. You can prevent them attaching to the skin if you, number one, wear light-colored clothes when you're outside, because then you can actually see the tick. If you're going to be outside, wear a long-sleeve shirt, tuck your pants into boots or socks to keep the tick from approaching the skin. There is a repellent with DEET in it that also is good to have. If you're going for a walk in the woods, stay in the center of the path because, again, the tick likes to perch on it, and if you brush against it, it will get on to your person. If you have dogs that roam free, any pet that roams free, you need to do tick checks of the animal and also your children if they're outside every day, just to be sure that no ticks are coming into the house or that they haven't picked up a tick. A child hasn't picked up a tick during the course of their playing.
So if someone, while they're doing their daily tick checks, finds a tick, what should they do?
If it's just on their clothing or something, it can just be taken off and thrown away. If it is actually attached to the body, then they should use a pair of tweezers, grasp the tick as close to the skin, as close to the person's skin as they can get, and just pull very firmly and wash it with soap and water afterwards. That's probably the easiest way to get it off.
So I didn't hear you say use gasoline or a match or Vaseline.
No, those are pretty much old wives' tale. They can do more harm than good. For example, of course, a match, if you light a match, it's going to possibly burn your skin, and it won't really necessarily make the tick pull out on its own.
And then so once someone has safely and successfully removed the tick, then what's your advice regarding their contacting their healthcare provider?
After they've washed the area, then they can call their family doctor and let them know what's happened, and then it will really be between them and their doctor what next steps are taken.
All right, so now how about let's talk about rabies, because I think you mentioned that you're getting a lot of calls in the spring about rabies too. What is rabies?
Rabies is a viral disease, and it's caused by a human being bitten by an animal that has rabies. And usually it's a wild animal, although it can be a dog or a cat. also.
So how about in Frederick County, what animals most commonly carry rabies or have been found to carry rabies?
Usually it's, in Frederick County, it's pretty much as it is in the state as a whole. It's raccoons or skunks or foxes or feral cats.
Well, how can people prevent rabies or prevent exposure to animals with rabies?
Well, don't approach wild animals. I guess teaching the children is the hardest part, because children are going to go right up to an animal, whether it's wild or friendly, or at least to them it appears friendly. So it's best to tell them, don't approach animals like that, even if it's a neighbor's dog. You know, they don't know how that dog will react, so it's best to just stay away. Children should stay away from storm drains, because apparently that's where raccoons like to travel. If you have your animal outside, don't let it roam free, because those animals are the most likely to have a fight or a run-in with, again, a wild animal that may have rabies.
So I guess I've heard people say, well, if there's a wild animals should be afraid of humans. So if it lets you get close to them, that might be a sign that actually it's sick and maybe a sign of rabies.
That's correct. That would be a bright warning sign if an animal is acting totally different from what you would expect it to. That is usually a sign of it's being ill with rabies.
And then, so in people's yards, so you mentioned their pets, so do the wild animals, what makes a yard attractive to wild animals, someone's backyard?
If you feed your animal outside and then just put the food out there and your animal either finishes it all or doesn't, that would attract a wild animal, particularly the raccoons. And also, if you leave your garbage can lid loose or off, again, it's attractive to the wild animals. So we always suggest people feed their animals in either the house or the garage. Be sure they keep their trash can lids on very tight, and to make the yard as unattractive as possible for the animals.
Very good. So what should people do if they think that they maybe have come in contact with an animal that has rabies, or if they've been bitten by an animal?
Again, the first thing you would want to do is wash the area with soap and water. You can also contact your family doctor. All bites of animals on people should be reported to the Frederick County Animal Control Office. And they will come out and take a report if it's a bite incident. They can also come out, you can call them and say you have a stray animal, you have a wild animal in your yard, and they could come out and capture the animal. And they can also capture an animal if it's involved in a bite incident.
Very good. Well, thank you. You've provided some good information that really is timely now that spring is finally here. So I hope that people will heed your advice to take the precautions necessary to avoid the transmission of both Lyme disease and rabies.
That would be very good.
Great. Thanks, Eileen, for joining us.
Thank you.
Thank you. And now please stay tuned for this month's Medical Myths.
Hey, look at that large group of paddlers over there.
Yeah, that's that Parks and Rec group again. Nice bunch. They're out here all summer. They do trips on the Monocacy and the Potomac.
They sure look like they're having a good time.
That's probably because the staff is so helpful and informative. Anybody can go on those trips.
Well, what am I doing out here with you then?
I don't know. Neither of us can swim, and you keep sticking me with that hook. Hey, what are you doing? You gonna flip the... Whoa!
Hello, my name is Doug Orner, and I serve as Director of Volunteer Fire and Rescue Service for Frederick County. I've been a volunteer with the Vigilant Hose Company in Emmitsburg, Maryland since 1972. Why do I think it would be a good opportunity for you to become a volunteer? It's a great way to meet new people, learn new skills, and also you can receive college credits for some of the training that you receive. And there's always that reward of hearing a special thank you or a smile on somebody's face whenever you've saved a life or helped them in some way, shape, or form. For more information on becoming a volunteer, visit our website, stop by one of our 26 stations throughout Frederick County, or give me a call at the office. I'll be glad to assist you in becoming a volunteer. Look forward to seeing you at one of the stations in the near future.
And now here's this month's medical myths. This month's medical myths are about colon cancer and can be viewed on the American Cancer Society's website. The first myth is that colorectal cancer is a man's disease. That is false. The truth is that colorectal cancer is just as common among women as men. Each year, about 150,000 Americans are diagnosed with colorectal cancer, and about 50,000 die from the disease. The second myth is that colorectal cancer cannot be prevented. The truth and the good news is that in many cases, colorectal cancer can be prevented. Colorectal cancer almost always starts with a small growth called a polyp. If the polyp is found early, doctors can remove it and stop the colon cancer before it even starts. To help lower your chances of getting colorectal cancer, get to and stay at a healthy weight. Be physically active, eat a diet with lots of fruits and vegetables, whole grains, and less red or processed meat, and limit the amount of alcohol you drink. And don't use tobacco in any form. The third myth is that African Americans are not at risk for colorectal cancer. The truth is that nationwide and in Frederick County, African American men and women are diagnosed with and die from colorectal cancer at higher rates than men and women of any other ethnic group. The fourth myth is that it's better not to get tested for colorectal cancer because it's deadly anyway. The truth is that colorectal cancer is often highly treatable. If it is found and treated early, and that's while it's still small and before it's spread, the 5-year survival rate is about 90%. But because many people are not getting tested, only about 4 out of 10 are diagnosed at this early stage when treatment is most likely to be successful. The final myth for today is that there isn't a need to get screened if you don't have symptoms. Or said another way, the myth is that you don't need to worry about colon cancer unless you have symptoms. The truth is that you might not recognize any symptoms until the last few weeks of your life. So please get screened starting at age 50. And if you have a family history of colorectal cancer, you may need to begin screening earlier. That's this month's medical myth. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. Welcome to this month's edition of Health Tips. Alcohol and drug use disorders is one of the themes for National Public Health Week, which is observed during the first week of April. Therefore, this month, we're going to discuss a serious public health epidemic, overdoses involving prescription painkillers. According to the Centers for Disease Control and Prevention, overdose deaths from prescription painkillers, also called opiate pain relievers, have skyrocketed in the past decade. Nearly 3 out of 4 prescription drug overdoses are caused by prescription painkillers. The unprecedented rise in overdose deaths in the U.S. parallels a 300% increase since 1999 in the sale of these strong painkillers. Every year, these drugs are responsible for nearly 15,000 overdose deaths, more than those who die from heroin and cocaine combined. Consider these facts. In 2010, 1 in 20 people in the United States, ages 12 and older, used prescription painkillers non-medically. In 2009, nearly 500,000 emergency department visits were due to people misusing or abusing prescription painkillers. Non-medical use of prescription painkillers costs health insurers nearly $73 billion annually in direct healthcare costs. Prescription painkillers work by binding to receptors in the brain to decrease the perception of pain. These powerful drugs can create a feeling of euphoria, cause physical dependence, and in some people lead to addiction. Prescription painkillers also cause sedation and slow down a person's breathing. A person who is abusing prescription painkillers might take larger doses to achieve a euphoric effect and reduce withdrawal symptoms. These larger doses cause breathing to slow down so much that breathing stops, resulting in a fatal overdose. There are steps that everyone can take to help prevent overdoses involving prescription painkillers, while making sure patients have access to safe, effective treatment. States can start or improve prescription drug monitoring programs, which are electronic databases that track all prescriptions for painkillers in the state. Encourage professional licensing boards to take action against inappropriate prescribing. Increase access to substance abuse treatment. Insurers can set up prescription claims reviews programs to identify and address improper prescribing and use of painkillers. Increase coverage for other treatments to reduce pain, such as physical therapy and for substance abuse treatment. Healthcare providers can follow guidelines for responsible painkiller prescribing, such as screening and monitoring for substance abuse and mental health problems, prescribing painkillers only when other treatments have not been effective, prescribing only the quantity of painkillers needed based on the expected length of pain. And individuals can use prescription painkillers only as directed by a healthcare provider. Make sure you are the only one to use your prescription painkillers. Do not sell or share them with others. Store prescription painkillers in a secure place and dispose of them properly. Talk with your children about the dangers of abusing prescription drugs. A 2009 survey from the CDC showed that 20% of teens reported that they had taken a prescription drug without a doctor's prescription. And get help for substance abuse if needed. The Health Department's Substance Abuse Program can be reached at 301-600-1775. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.